Hello, my name is Nicole Daniels, and I am a licensed practical nurse, BSN student nurse with Indiana State University. This health promotion will be about HIV prevention, and the population at risk is African American young men, college age, and or gay or bisexual population as well. The objectives for today are to define the risk factors associated with HIV infection, describe the transmission of HIV, to list the ways to prevent transmission of HIV, to describe how HIV is diagnosed and treated, and to provide some resources to aid in education and prevention of HIV for at-risk populations. Before we get started, show what you know. Listed in the description below this video, you will find a handout to review some of the material that will be covered today, as well as a test that you can take both now and after the presentation to test your knowledge. So pause now and take the test before we begin. When we talk about HIV prevention, it's important to first look at some statistics. Take a look at the population that is at risk. The CDC data shows that 44% of new HIV cases in the United States are in the African American population. CDC also shows that 55% of gay and bisexual youth are diagnosed with HIV were also from that African American population as well as the Latino population. Some risk factors associated with HIV. Perceived risk among college students is low, making the college age level to be a risky category. Ineffective use of condoms, an increased amount of sexual partners, alcohol use in association with risky sexual behavior, lack of awareness of HIV status, and or lack of testing, substance abuse, and of course, along with substance abuse is also sharing of needles for injection drug use. And as you can see over here in this infographic, for HIV.gov, 1 in 7 living with HIV are unaware of their infection because a lot of times with HIV, you won't have symptoms that you have the infection itself. So how does transmission occur? Well, the most prevalent form of transmission is going to occur from unprotected anal or vaginal sex with someone who has HIV. The more risky of the two would be receptive anal sex. The sharing of needles or syringes and or equipment with someone who has HIV. Transmission occurs from exposure to certain body fluids such as blood, could be seminal fluid, pre-seminal fluid, rectal or vaginal fluids, and breast milk. Coming into contact with a mucous membrane or damaged tissue, or for somebody to directly inject it into the bloodstream. Now, when I say mucous membranes, those are going to be the tissue that's found in your rectum, vagina, penis, or mouth. In a study that was done by Holiday, it was found that gay and bisexual college-age African American student population, HIV and AIDS knowledge was high. However, their perception of their risk for getting HIV or AIDS was actually very low, influencing a low testing in that population. Therefore, a lack of awareness of HIV status is a huge barrier and risk factor for the disease itself. Lack of awareness directly correlates with an increased risk of spread. So prevention is key. Number one way to prevent is, of course, abstinence, which is the abstaining absolutely from any type of sexual contact, limiting the number of sexual partners, so having a monogamous relationship, condom use. In one study, it was found that only 35% of students were found to be using condoms related to the risk perception and the lack of spontaneity. Wasn't as fun. Never sharing needles. Communicate with your sexual partner before sex. Know your HIV status. So get tested, know your status. Communication part is part of that knowing your status. You also should be communicating with your partner about what their status is and if they know their status. Have they gotten tested? Discuss post exposure prophylactic treatment with your physician after a potential exposure occurs. And if you are in an at risk category, also you can discuss pre exposure prophylactic treatment with your physician if you meet criteria. Over here in this infographic from the CDC, you can see that PrEP or the pre exposure prophylactic been shown to reduce the risk of HIV infection in people who are deemed high risk by up to 92%. That's huge for prevention. Diagnosis and treatment. So when we talk about HIV prevention, it's also important to just be aware that testing is so important and critical because when it comes to disease diagnosis and treatment, early diagnosis, early treatment is very, very important for a good prognosis. So testing, very easy to do. Testing's done via a blood sample or oral fluid that's collected at your clinic or physician's office. This test is either done in the clinic or the office as a rapid test, or it could be sent out to a lab, and that might take a few more days to come back. If your result is positive, you'll be counseled, and also a second confirmatory test will be performed. Treatment will include multiple medications called antiretroviral therapy. Now, this antiretroviral therapy, there's a few key things to know. One, not a cure. There is no cure for HIV infection. However, you can still live a very good and active life with antiretroviral therapy. Very important with this therapy that you take it every day. This treatment helps to keep your viral load low, and that viral load is the amount of virus that's in your blood or your body fluid. Because it's helping to keep that load low at a low level, it also reduces your chance of spreading HIV to others. Usually given in a combination of 3 or more drugs. There are types of medications that can have multiple meds combined into one pill as well. Big important piece of antiretroviral therapy is the strict adherence to the med regimen. You have to make sure that you get onto a routine taking your medications at the same time as prescribed by your physician. And the reason for that is because you want to make sure that we're keeping that viral load low, but also if you stop taking the medications, you could run into an issue with drug resistance where your body stops reacting to the medication. There's many different alternative regimens that can be prescribed. So it's important that you communicate any concerns or any issues that you have with your medication regimen with your practitioner for the best success. Some resources, lots of resources out there. It's important to just know that you can find all this information at the tip of your fingers. At the CDC, you can find lots of information on HIV prevention, testing, treatment, and stigma. HIVrisk.cdc.gov, great little risk assessment tool, helps define and customize information on your risk and prevention based on your answers. HIV.gov can learn about ending HIV epidemic and America's plan. The FDA website You can learn about the medications that are used to treat HIV. And then also at our local Maryland Department of Health website, you can see how the State Department of Health, what their plan is for HIV prevention and treatment, and also the locations for free testing. All right. So thank you for listening to the health promotion today on HIV prevention. Please make sure that you follow up with taking the test again to test your knowledge and see how you did.